The following segment is sponsored by 901 Vascular.
Welcome back. You're watching Live at 9. Thanks for joining us. This morning, Lauren Albertine with 901 Vascular is joining us to talk about peripheral arterial disease. Okay, let's just call it PAD.
Yes,
thanks
much
for
easier.
coming in. So arteries, right? They are that main pathway that carries blood from the heart and all throughout your body. So what is the main disease that you can see affecting PAD?
Basically what that is plaque will build up within the arteries, and when it's below the waistline in the legs, it's called peripheral arterial disease because it's in the periphery. And what happens is that plaque builds up and it causes a narrowing, so it decreases blood flow, and it can even cause occlusions in those arteries, especially the smaller arteries below the knee.
What was so interesting to me is you have a lot of direct experience with PAD.
Yes, I do. I have over 20 years of experience in healthcare alone, and
You're not. You look like a child.
well, thank you.
Okay, sorry. Proceed.
So myself, as well as our other three providers at 901 Vascular, have extensive years of experience within the city and specifically at Regional 1 at the Trauma Center. So we have lots of vascular experience in all realms, being acute and chronic.
Yeah, level 1 trauma center. What are the risk factors?
There are two main risk factors, which would be diabetes mellitus and smoking. And other risk factors would be high cholesterol, a high fatty diet, sedation, and even there's a family aspect in there too, a genetic aspect as well.
Okay, so I've been worried about my big toe, feeling a little numb in these high heels, and now I'm like, oh no, is it PAD? Like, what are the symptoms?
So the symptoms, excellent question, because people do have these curiosity of these sensations in their feet and concerned about blood flow. So one main symptom that we look for is something called claudication. And we look for what a short distance claudication, such as if a patient is walking or an individual is walking a block, they will start having pain, aching, cramping in their legs, in their thighs, calf, or feet. This graphic right here shows what's called angiosomes, and that is where the smaller arteries below the knee, called the tibial arteries, what zone within the tissue, bones, and muscles that are fed by those arteries. So you can see if there's a narrowing or a blockage in those arteries where the tissues won't be fed with that oxygen-rich arterial blood flow.
I'm so glad we could see that diagram. You were telling me about someone who you were helping. Can you just talk about treatments and share that individual story?
So in particular, an individual comes to mind who he loves sporting events, loved going to the Grizzlies games, Memphis Tigers football games, and he noticed that he couldn't walk up the stadium steps without feeling pain in his legs, and decided actually to stop going, and walking through the parking garage was too much because he had that short distance claudication where he would have to stop and rest. So he came to see us. We did a procedure called an arteriogram, where it's just a tiny needle stick to open up those arteries and maintain patency to open that blood flow. And after we saw him, we worked on him. He's walking his desired distance. He's going to games. He's able to walk up those stadium steps with no pain.
All right, so back to the Tigers.
Yes.
All right, we're going to put the information on the screen. You said that people do have to go through their primary doctors.
Yes, since we are a specialty office, insurance requires a referral from the primary provider, but a patient can call and we can get that started for them. So don't not pursue it because you don't have a primary care provider. Give us a call. We can get it taken care of.
Thank you so much.
One content segment during Live at 9 today was paid for by 901 Vascular.